Let's talk wisdom teeth, Dr. Jones. First of all, I really want to know, if one has a wisdom tooth, does one become wise? No? Yes?
Yes. Definitely. If you have wisdom teeth, you become... No, I think it's just because...
I know my problem now because I don't think I had one. I'm not so sure, but I surely never... I don't remember any complication with wisdom teeth. So now I know my problem. Now I know my intellectual problem. Okay. Question. Wisdom tooth, like root canals, even more so maybe, have a tremendous bad reputation out there. It's kind of like... I need to pull my wisdom tooth. So first of all, shed some light on why it happens and definitely let us know, is it really that devastating? Is it, apparently wisdom tooth is worse than a hip operation, is it that way? Why, where, what? Tell us all about wisdom teeth.
Well, in our office, we don't see that very often, but the first place that you should go when we start talking about wisdom teeth is, number one, let's again go back to weighing the risks and the benefits. What are the benefits if we keep our wisdom teeth? First of all, the wisdom tooth should be a tooth that is going to come in to your mouth, should function properly, should be able to be kept clean. You should not experience a high rate of decay, whether you're having a filling done every other year. These are reasons why the risk then might be greater to keep your wisdom teeth than it would be to remove them. At about age 17 to 20, 22 is when we start noticing our wisdom teeth erupting. At earlier than that, about age 14 or 15, we can start trying to predict whether these teeth will come in with good function. If they don't, or if we realize that they're not going to have enough room to come in, or if there's going to be another problem, then we may decide to remove them. If we decide to remove them, we have to, again, decide that the risk of removing them is far less than the risk of leaving them there for the rest of your life, or certainly less than the risk of waiting until you're 25 or 30 or 35 or 40 to remove them then. And in my opinion, the risk is much greater to remove wisdom teeth the later in life that they're removed. So in our office, if we decide that wisdom teeth should be removed, then we try to make that decision as early as we can and then remove them in the teenage years because, again, the benefit is that the body heals faster. It's much less of a problem. The bone is softer. The teeth come out easier. The recovery time is less. The amount of swelling is less. It's not uncommon for me to call somebody in the evening after we've removed their wisdom teeth, and a teenager, for instance, and the parents tell me, well, they went to the movies, or, they're with their friends, they're doing this certain activity, and they haven't noticed that there's been a real problem. Might it be a little uncomfortable? Sure, it might be a little uncomfortable, but it certainly hasn't stopped them from doing their social activities that they were planning to do anyway.
Okay.
So we decide if wisdom teeth should come out, then we try to get them out as early as we can.
Well, all right. So, of course, that makes lots of sense because nobody wants a certain operation at a higher age than a younger age. I mean, we know that even a normal any little injury we have when we were 20, it's cured a lot faster than 40, 50 years later. So
that's right.
No doubt about it. So that's a good thing. So, and obviously medicine and the instruments have been so that while the person is there, he doesn't have any problem. On top of it, in your case, if a person really, really is very afraid of a wisdom tooth because of that myth from the past, you just go and give him sedation dentistry. And
absolutely.
Yeah? Absolutely.
We can sedate them. They don't even know that they were here, and aside from, a little bit of discomfort that usually Tylenol and Advil can give up. In fact, Helmut, I can't ever remember the last time I even wrote a prescription for Vicodin or for codeine for wisdom teeth, because our patients just don't experience that. But if they're afraid, we can sedate them the next day. They don't even remember being here. They don't remember the process. So it's a wonderful adjunct treatment to be able to offer to our patients who might still have that myth that taking out wisdom teeth is a harrowing experience, which it really isn't.
Right, and then you said that most patients, are literally, back to normal, relatively normal activity the same day. So
the same day or certainly the next day. Yeah.
Right. So at the very worst, if a person is a little concerned and maybe already a little older or whatever it may be, he should just schedule the operation on a Friday. So Saturday, Sunday, he's out there well off, and Monday he's back smiling in the office.
Absolutely.
All right. Absolutely. So now we have it about wisdom teeth, and we know now why I have to struggle in life so much, because I never had any wisdom teeth. All right. Thank you very much. Bye-bye.